Well, hello, good afternoon, and happy Monday to all of our media here in the room and to all of my fellow Mississippians. I had a great opportunity yesterday to get back on Facebook Live and pray with literally hundreds of thousands of fellow Mississippians, and I really appreciated that opportunity and got to spend some quality time reading the Bible with my daughters, and I just want to thank everybody across the state who joined us yesterday. It was really a special day for us, and I know a special day for many other people because I've seen your comments, and I want to thank you for that. I also want to thank you all in our state for your efforts to help us slow the spread of the coronavirus. I know there's been a lot of conversation, a lot of talk, and a lot of discussion, but the fact of the matter is that I want you to know something, and I want it to be very, very clear. Your efforts are working. What you are doing back home is making a tremendous difference. Now is the time for us to continue. Now is the time for us to push the gas pedal even harder. But every time you've worn a mask, every single time you've chosen to skip a party, everything you've done, every sacrifice that you have made, and every smart decision you've made has been helping. In fact, it has made a difference. And our numbers certainly bear that out. Our 7-day rolling average peaked on July the 30th. Now, it peaked for now. It can go back up if we don't continue to be diligent, but it peaked on July 30th at 1,361 cases. Today, that number is at 932. That's approximately a 30% drop in new cases on average from a 7-day rolling period. One of the numbers that our coronavirus task force in Washington looks at very, very closely is the percentage change in number of long-term care facilities with 3 or more confirmed or suspected COVID-19 cases for 3 consecutive weeks. That number is up 3.7% nationally. In Mississippi, it is actually down 57%. We are doing our level best to protect our nursing homes, even in the midst of what has been a rapid spread in some places. When you look at the overall numbers, when you look at what occurred 4 weeks ago, our 7-day average was 1,029 cases. 3 weeks ago, and all of these are actually Tuesday to Monday since we got this morning's data. 4 weeks ago is 1,029 cases on a 7-day average. 3 weeks ago, it peaked at 1,295 cases. 2 weeks ago, that number was 1,166 cases. As of today, in the last week, that number is actually now finally below 1,000 and at 932 cases per day on the 7-day rolling average. Now, I tell you all of this because I want you to know I believe in positive reinforcement. Our measures are working. We can't change what we've done in the past, but we can change what we do going forward. If we can get even more participation across this state, if we can get even more people to not go to parties, if we can get even more young folks to stay out of bars, if even more people will come together and wear a mask, and obviously we do have a statewide mask mandate in place now, if we can convince more and more of our fellow Mississippians to continue to socially distance, we can make a huge difference. The fact is, the hard truth still exists. It means that we can feel confident in our approach, but we must continue our efforts. The masks are working. Your increased focus on slowing the spread is working. It gives us hope, and it gives us a roadmap. We know that we do not have to shut down our society. We need to continue to keep doing what we've been doing. If we can hit the gas for the next several weeks, we can really drive these numbers down. Our R0 now is actually below 1 for what seems like the first time in weeks and weeks and weeks and weeks. We can drive these numbers down, and then hopefully we can begin to breathe easier. We can get our kids the education that they need and they deserve. We can help people earn a living, and we can save lives while doing it. Again, I wanted to bring you, as I have every single day of this pandemic, the truth. And the truth is what we are doing is working. But the truth is also that we cannot stop now. We cannot let our guard down. We cannot go back to where we were in mid-June, or some would even say around late May, when we completely changed our focus from protecting ourselves against the virus while living our lives, and we must focus on making sure that we're protecting ourselves and protecting our neighbors. I'm optimistic about the improvements, but I'm also steadfast in my belief that if you will wear a mask, if you will maintain social distancing in public, if you will not gather in large groups, particularly for social reasons, we can make a huge difference. And I will tell you, I believe that we are at a critical point. It started last week. We saw the numbers coming down. The statewide, we had 37 counties that were on the list of mandated masks. We went from 37 to 82 to convince you that now is the time that we can do even better. If we can take our participation rate in those original 37 counties up 5 or 10%, and if we can get even better participation throughout the state, we can continue to see these numbers come down. It's the exponential growth that we had to deal with in late June and July that can be counteracted by if we continue to see less than one person being infected for every one person who has the virus, we can see the numbers come down. Now, these are all leading indicators. If this happens and if we do it right, then we have a chance of those lagging indicators that continue to stay up, like hospitalizations and, unfortunately, deaths. We can start seeing those to turn over as well. That is our goal. That is what we're going to continue to work towards. And with your help, we can make a difference. Dr. Dobbs is here today to give us a further update on numbers.
Thank you very much, Governor. So today we're reporting 476 new cases and sadly 16 additional deaths. This is certainly an improvement over previous weeks. We do see a drop after the weekend, so I wouldn't expect it to stay this low in future days, but certainly the trend is encouraging. So would like to very much encourage everyone to continue with the simple things that work: 6 feet, a mask, and small groups only. Really just stay around your family. If we're very diligent about this, we can make it a lot more likely that we'll have a successful school start if there's less coronavirus circulating in the community. If we look at what's going on with the schools so far, we have 22 different schools reporting cases of coronavirus so far. Again, not a surprise because we know coronavirus exists pretty widespread in every community right now. We've had 19 cases identified among students and 15 among employees for a total of 34 cases thus far identified in schools. We will plan, as we get aggregate data, to release it on the website with additional data, for each county so that y'all can have that information to follow. We were very excited that we completed our Lexington testing project over the weekend. We did test all nursing home residents or the majority of nursing home residents employees on Thursday, and we offered free testing throughout the community on Friday and Saturday. It was quite a success with 561 individuals coming out to get tested, which is a substantial proportion of the residents in that area. And in that group, we identified 14 unknown coronavirus cases. We're able to go ahead and get our contact investigators on the cases quickly so that we can try to limit additional spread. And we'll have a testing location adjacent to the health department this week on Tuesday, Wednesday, and Thursday to test people who have been exposed and contacts to those 14 individuals so we can further work to sort of settle down the spread in the community. We're very excited. We think this is a very successful project. We also offered free antibody testing as part of this effort, and 235 people selected the option to get antibody testing, and of that number, 17 were positive for antibodies, indicating 7.2% of people had previous infection. None of the 17 had positive swabs as well. They were a separate group. Kind of fits within the range that we expected for for our seroprevalence, or the percent of people who've had coronavirus before, in that sort of probably less than 10% range. But so then that also reiterates the fact that we've got a long way to go to herd immunity, consistent with our previous messaging. And if we look at our hospitalizations, we have seen stabilization in the number of hospitalizations, with a mild sort of steady increase in ICU stays and ventilator utilization. And that certainly makes sense, because we know it takes a while for people to get sick and then require ICU care. Still a lot of stress on the healthcare system. The best thing we can do is not get sick so that we don't get ill, but also don't stress out the healthcare system for others who need it, not only for coronavirus, but for other severe life-threatening illnesses. Thank you, Governor.
Thank you, Dr. Dobbs. Appreciate you and your team and all that you're doing to help lead us here in the 6th or 7th, I guess the 7th or 8th month of this pandemic. At this time, I'm going to turn it over to Director Michelle on emergency management.
Thank you, Governor. Good afternoon, everyone. Just give an update on the coronavirus emergency relief program for counties and municipalities. As of to date, we've received a total of 574 applications. That's both on the red public assistance track and also on the red track for the CARES Act 100%. So 573 total applications received. Of those 573, 130 of those are applications that are coming through the red track, which we're calling the 100% reimbursement. And as a reminder, those are those applications that were not eligible under public assistance but are eligible under the wording under the CARES Act documents. And then in addition, we've got 27 drafts, which means we've got a number of others that counties and municipalities are still working on those. So we continue to process those. To date, we have made disbursements out of our CARES Act to counties and municipalities of $4.5 million. So we know that we've still got a number of applicants that we are anticipating to receive. A reminder to everyone out there, if you have questions about your applications, about what is eligible and what is not, our call center is open from 9 a.m. until 3 p.m. Monday through Friday. That number, as a reminder to everyone, is 844-522-7367. I say again, 1-844-522-7367. On our PPE, we continue to make deliveries thanks to the men and women of our National Guard that are making those deliveries, making county point of distribution deliveries today. We did make 2 emergency pushes to 2 of our long-term care facilities. Those are pretty much standard. We do those to those long-term care facilities that have last-minute needs. We're pushing those out. Continue to do a great job with that, staying on top of needs that are out there. And then finally, just real quickly, reminder, it is hurricane season. We are watching another tropical wave that's coming off the coast of Africa. Currently, that track is projected to also go off into Atlantic, so keep your fingers crossed. But we'll be watching that over the next 5 to 7 days to make sure where to be headed to. Governor, that concludes my update, sir.
Thank you, Director Michelle, and thank you to your team for what you're doing, particularly on that city and county program. It's a fine example of the infrastructure being in place at the Emergency Management Agency to distribute funds, because that's what we do with the Stafford Act, is we deal with federal monies that are distributed out to those affected entities. And I certainly appreciate your team and what they're doing so that we get much needed monies and revenue to our cities and counties for their COVID-related expenses. And so with that, I'm going to just mention there was a report that came out with respect to unemployment. You may have seen it. Mississippi's unemployment has fallen to a seasonally adjusted 8.2%. That means that Mississippi is currently number 7 in the nation in jobs lost in February through April that have now returned in May and June. Our economy is moving. That is critically important for the people back home. That's critically important for those individuals that have the opportunity to put food on the table for their loved ones. And I want to congratulate all of our fellow Mississippians, our small businesses, et cetera, that by and large have reopened. The thing that we know for sure is the thing that we've said from the beginning, and that is for those individuals in those states that have prolonged shutdowns, weeks and weeks and months of shutdowns, it's going to have economic results that are not very favorable. We are not in love at all with our economic results, but we're doing far better than the vast majority of other states. It's because we have slowly and tactfully and with a surgical precision attacked this virus rather than statewide, across the board measures. So with that, I'm going to turn the floor over to questions. Yes, sir.
Thank you, Governor. Over the weekend, President Trump announced 4 new executive actions when it comes to, aid for American workers. One of it is $400 extra on top of unemployment benefits the state would offer. Now, Mississippi would have to contribute to the first $100 of that, with still 8.2% in unemployment. Do we have the money in Mississippi to make up for that $100 per person? And what talks have you had since it started to make sure we can do that?
Well, thank you. We have been very involved and engaged with the administration in conversations with respect to all of the items that are being talked about in the Congress as well as in the administration. This is an issue that obviously has occurred over the weekend. We currently have a White House call that is ongoing. I participated in the first 30 minutes prior to coming over here. Today I have staff learning more about the President's EOs. I appreciate the President stepping up and trying to help workers in this challenging time. And I think it's certainly something that the American people are appreciative of, that the President takes action. There are a lot of members of Congress that talk, the President acts, and I appreciate what the President is doing. Now, while you're going to get more of an answer maybe than you bargained for when asking for this, but I think it's important that the people understand. Let's first talk about the Unemployment Trust Fund in Mississippi. Many of the folks that are watching today have listened to me talk about the numbers. Most of you have listened to me talk about the numbers for the last 17 years. I do have the advantage of serving as the Chief Financial Officer of the state for 8 years and then as Lieutenant Governor. And let me just help you understand the numbers. Prior to this pandemic, on March the 8th, Mississippi's Unemployment Trust Fund had $706 million in it. Mississippi was one of the 5 most secure trust funds in all of America. Much like we had a rainy day fund that was full, we had a fiscal shop that was in order, $706 million. When we looked at the various results of the pandemic and the significant uptick in unemployment, we started getting very concerned. Even though in our state we had a very healthy balance going into this, we knew that it was going to cost significant amounts of money out of the trust fund to pay these unemployment benefits. At that time, Jackie Turner, the head of the Mississippi Department of Employment Security, asked the Mississippi legislature for between $500 and $700 million for the trust fund. The Mississippi legislature made the decision to provide $181 million. Prior to that $181 million going into the trust fund, that $706 million balance that we had on March the 8th was down to $316 million last week. The $181 million has gone into the trust fund that the legislature gave us. An additional week of payments have occurred, and so we're now sitting on $489 million in our trust fund. So even after $181 million of CARES Act funding going into the trust fund, we are still $217 million below where we were just in March the 8th. Now, let's look at the pandemic unemployment assistance that occurs. Remember, that was a $600 payment. People in Mississippi need to understand that just for comparison purposes, there was an increase in unemployment paid for by the federal government in 2008 and 2009 during the financial crisis. That was the equivalent of an additional $25 a week. So this $600 a week is a number that literally was 24 times what the Congress did in 08 and 09. It was exceptionally larger than what occurred in 08 and 09. That $600 a week was paid entirely by the federal government. That payment was, over the last 5 weeks, occurred between $125 and $140 million per week. And so if you look at that $125 to $140 million a week that $600 cost the federal taxpayer, if Mississippi were to opt in to this particular opportunity that the president signed over the weekend, the benefit would be cut from $600 a week to $400 a week, still approximately 16 times more than what was paid in the 08-09 financial crisis. But if you consider that that $600 to $400 cut would cost in aggregate between $83.5 and $93.25 million per year, Mississippi's 25%, because it's going to be going through the Stafford Act, would cost us between $21 and $23 million per week. Our normal state unemployment benefits, just for your reference, currently cost us $22 million last week. And so this additional $100 would be an approximate doubling of what the unemployment trust fund would have to bear almost immediately. And so I tell you all of that simply to say this is not as easy of an answer as some might think. My staff is currently on the call with the coronavirus task force. Secretary Mnuchin was on the call as well. He was describing the conversations in Washington, D.C. But here's what I would say to you, that the president, through his executive order, did all he could do. He stepped up to help the American people. But what really needs to happen is the Congress needs to come together, and they need to recognize that the Democrats' proposal out of the House, which called for spending $3.4 trillion, is outrageous. The Senate Republicans asked for an additional $1 trillion, and my position is if the Congress is going to act to help the American people, that number should be closer to $1 trillion than it should be to the pie in the sky $3.4 trillion number that the House Democrats wanted in Washington. And the Congress should pass a bill. They should get back to the negotiating table. They should pass a bill. They could use the $1 trillion to help the American worker get through this. Probably not at the $600 level, because as has been pointed out, for many people in our state, between 70 and 75% of the people that were eligible for the $600 actually were taking home more money by not working than they were prior to losing their job. That certainly is not a recipe for getting people back to work in the economy. And so I'm hopeful that the Congress will work together, will come together and make a good decision, will pass relief. The president has done his part. Now I hope the Congress will do theirs.
So if I just may clarify that was a lot of good information, but when you compared the unemployment money per week, Mississippi won't have a problem footing the first $100 I got out of that, right?
No, I wouldn't say that. So just to give you an example, if we spent $22 million a week out of the trust fund plus $21 to $23 million, that'd be $44 million on average per week. We currently have $480 million in the fund. That's 10 weeks worth of payments. 10 weeks. So what I would say to you is we have not made a decision yet if we will participate in the enhanced unemployment benefits. remember, the first time the Congress enhanced the benefits, they did so by paying 100% of the cost. And that's the reason that the Congress needs to act. Because if Congress wants to increase benefits under the Federal Pandemic Unemployment Assistance Program, the FPUA program, then they need to pay 100% of the benefits. And that way it wouldn't put stress and undue stress on our trust fund. Jeff.
Governor, along those lines, as far as the decision of whether we would participate if Congress doesn't come up with something, is that a decision you can make and spending you can authorize, or would that require the legislature?
Well, I will tell you that we are looking at all possibilities right now. We have executed a significant number of executive orders with respect to the Department of Employment Security, and it is my understanding and expectation that is something that we could do under the Stafford Act, because we authorize expenditures under the Stafford Act regularly, and that's the reason the President utilized the Stafford Act to actually do this itself. But again, let me be clear, I'm hopeful that the Congress will get back at the negotiating table, that they will come up with a plan, and they will continue enhanced payments at whatever level they choose, and that they will fund those payments, and that it will not be asked of the states to fund those payments. Because I can tell you, when I mentioned earlier that Mississippi at $706 million on March the 8th had one of the 5 most healthy unemployment trust funds, I can tell you that there is a large number of states out there that simply do not have the resources to fund those enhanced benefits. This is a decision that the Congress needs to make. If they want to expand and extend additional unemployment benefits through the Federal Pandemic Unemployment Assistance Fund, then they need to fund it. So, yes, ma'am.
Dave Elliott with WLOX has a question.
Thank you, Renee, and I'd like to request a quick follow-up, if I could.
Sure.
Governor, legislatures reconvene. House already voted to suspend deadlines to consider bills, including a Department of Marine Resources budget that's now over in the Senate. Over the past few weeks, some DMR workers have not been paid, others have reduced salaries. Just on the surface, what are your thoughts on how critical it is that that budget gets done? And is there anything that might stand in the way of your approving what the legislature comes up with?
Well, thank you for that question, Dave. I think it's extremely critical that the budget for the Department of Marine Resources gets completed. I am very hopeful that can occur because you're right. The agency initially put some of the employees on furlough prior to us having the ability to legally determine that we could keep the agency open, at least certain parts of it that were required by federal statute as well as the Constitution. And so there are several things that need to be done, but there's no doubt that that is a budget that needs to be passed by the Mississippi legislature. And I'm confident that they will do that, hopefully sooner rather than later. As long as they pass a bill similar to the position that the Senate had during the regular session, which, by the way, the position the Senate had was identical or very similar to the bill that initially has passed the Mississippi legislature for the last 15 years, then I see no reason why I would not agree to it. But we'd have to certainly monitor that and see what the exact language is. But I'm hopeful that they can get to an agreement and get to a deal, and hopefully they can do so quickly.
Okay, here's my follow-up on that. Behind the scenes, what's really been behind this budget delay is some lawmakers, primarily in the House, want more control over how oil and gas lease revenue or Go Mesa funds are spent. Historically, that's been the governor, coastal legislative delegation, and DMR deciding that. Do you welcome more legislative participation, or are you ready to fight for how it's been done in the past?
Well, the one thing I will say, Dave, is you've hit the, I guess as is often the case, you've hit the nail on the head. With respect to a few members in the House, it's all about control and power. What I'm interested in is getting a budget that is passed, similar to the way in which we've done this for the last 15 years, because I believe that's what's in the best interest of the Mississippi Gulf Coast. When I ran for office, the citizens of the Mississippi Gulf Coast overwhelmingly worked day and night to help get me elected, and they did so because they knew that I would stand up and do what's best for the coast. And for this particular money, which obviously is oil and gas leases on off of our shore, this is money that I think that we can leverage to do some exceptionally fantastic things throughout our state. I'll give you an example. Recently, we announced, and I'm sure y'all covered it, but recently we announced a project that was approved by the federal government that is going to spend a little over $7 million on a workforce development, workforce training center in Hancock County. You may recall that 4 or 5 years ago, I worked very closely with Senator Moran and a lot of local Hancock County officials to actually give Pearl River Community College the money that they needed to purchase the land there in Hancock County for this particular building. This is the way the process is supposed to work, whereas the legislature certainly is engaged and involved and invest this $1 million to get this project kick-started. And then, as governor, I had the opportunity to go and work with the federal government to get this project approved. And so I welcome participation by the members of the legislature. I think that's critically important, and I look forward to working with members of the House and the Senate to make sure that the projects that are funded are in the best interest of the entire state, and particularly the best interest of the Gulf Coast. Yes, Jeff.
Governor, two questions really. One about DMR. Not long before you started this press conference, Speaker Gunn had told several of us that their plan is to pass a DMR budget, and as he put it, put the Go Mesa funds on the shelf for now, not deal with those, and come back in January and make that decision. Is that acceptable to you as far as just getting a DMR budget passed for now?
Well, I'm not going to speculate on any specific negotiations, but what I would tell you is there are a large number of Go Mesa projects that are ongoing. And what I'm hearing, and I'm not sure if other leaders are hearing it or not, but what I'm hearing is that some of these contracts for these projects for these cities and counties are requiring the cities and counties put up money so that the projects will continue while there is this debate. And so what I think really should happen in this legislative session that the Speaker and Lieutenant Governor called today is what I think they ought to do is, my understanding is there's a couple of things that need to be fixed in the Back to Business program, and we are supportive of those. And in fact, my team at MDA has worked real hard to point those out to our legislative friends and allies, and I'm hopeful that they'll fix the Back to Business program so we can get more of that money out on the street. I believe very strongly that we should fund the pay for those 23,157 teachers that the school recognition program provides for. Remember, those are teachers that operate and help produce in A-rated districts, B-rated districts, and those districts that have seen an improvement in their letter grade. So if you go from an F to a D, then you're eligible for the school recognition program. There's about 23,157 teachers across the state that are entitled to about $29 million. I think the legislature ought to fund that. And I think that they ought to pass a DMR budget that appropriates money for the agency to operate and allows for the executive to manage the Go Mesa funds in exactly the same way that they have been managed since 2005.
Following that is the House has already voted earlier to override the veto, partial veto on the education budget. Senate expected to do it soon. Would you comment on any of those proceedings at this point?
Well, I don't think it would be premature to comment on anything at this point. What I will tell you is, that doesn't surprise me. There's no doubt that there are those in the House that think that they can get a pound of flesh from me. It's all personal because of some perceived advantage that I was able to get on conservative legislation in the last 8 years. I'm not at all surprised that they did that. But here's the point that people need to look towards, is are the 23,157 teachers going to get paid or not? If the 23,157 teachers that are due $29 million get their additional money, then it will be a huge victory for the state of Mississippi. If individual members of the House want to punch me in the face, if they want to stab me in the back, that's fine, as long as those teachers get the money. It seems like to a lot of them it's a political game. To me, I just simply want the teachers who earned that extra $29 million not to get their pay cut. Bottom line, that's all I'm interested in. Yes, sir.
Thank you. Dr. Dobbs, this question is for you. So we opened up with some positive trends, it looks like. There are some averages that are going down. Unfortunately, with some school districts, we have up in Corinth, I believe, 116 students and I guess employees after 1 week are in quarantine. Are you at all concerned with schools opening up that we could see another spike that would put stress on the hospitals? And what advice can you give for these schools to prevent this from happening?
Yeah, of course, we're very concerned about increasing cases related to, people getting back in close proximity. That's a risk. Just would really urge them to follow the guidelines, make sure that all the things that they've worked out to make sure that they can keep the kids separated, the masks, and then the tracing when they do find cases is going to be extremely important. I'm actually a good bit more worried about the colleges and as far as like that driving up the case rate. I got a disturbing report today that move-in day, a bunch of folks were walking around without masks on the campus, having fun, clustering up. It's hard, it's going to be those things, those sort of social sort of things that are going to happen on the college campus. The school day and the classroom day can be relatively well controlled if you have the right sort of discipline to follow, to design a plan and follow it. We'll need to be very conscientious about what's going on in college towns. That's really probably where our greatest vulnerability is, not in the college classrooms, but in the college towns where folks are doing social things that spread the virus.
Yes, sir.
This is a question for Dr. Dobbs. You mentioned earlier that we're seeing some leveling in the number of cases, and like the governor said earlier, now is the time to hit the gas on wearing masks and things like
Yes.
that to continue to drive that down. How long do you think that process is going to take to get the cases below a number where we can say, okay, we've got this under control to a degree?
Well, we won't have it under control until we have a vaccine, unfortunately, and it's always going to be there waiting to resurge. But it also demonstrates that if we just do the simple things, like we've been saying the whole time, we can still conduct our lives in a reasonable way. If we look at New Zealand, they probably are a model for the world with their focused and their steadfastness in making sure that they're paying attention to everything they're doing, and they're even though they've essentially eliminated coronavirus from New Zealand, they're at a risk, and so you have to maintain some level of constant readiness to prevent transmission. So, we just got to find the new normal that we can live with that keeps the virus down, and if we can keep the R0 value less than 1, and just keep that way, eventually it'll keep drifting down until we can get a vaccine, and then we'll have a lot more capacity for those traditional freedoms that we all love.
And I think the key point is managing expectations. We've been doing these press conferences for months and months and months and months, and have repeatedly said that our goal is not to eliminate the virus to zero, because that's not a realistic goal in today's world. Our goal is to protect the integrity of the healthcare system such that every single Mississippian that gets the virus can get better because of quality health care. Now, we know that the significant rise in cases in late June and July certainly put stress on our healthcare system. And so that gave a lot of us concern. We talked about it for weeks. And the good news is the people of our state stepped up and they started doing the little things again. They started paying attention again. And if we can continue to see that, we can continue to drive the numbers down, which ultimately is going to reduce the stress on the system. You know, if we can take hospitalizations from the 950 to 975 number where we've been now for about 2 weeks and start driving that and get it in the mid 800s and then get it to the mid 700s and then get it to the mid 600s and maybe even get it back to that 490 level that I talked about on, I believe it was June 17th, which is about half of where we've been. Well, then we can start, we can find ourselves in a better position with less stress on the healthcare system, which again will allow us to feel better. But even then, we can't just say, okay, it's all good, it's all gone, we're back to where we were in June. That is not going to be the case. We have to, for the, at a minimum, the rest of 2020, we've got to be diligent. We've got to do the little things. Because none of us want to go back to where we were in late April where we had a 2-week shelter in place. That was not good for anyone, wasn't good for small businesses. It was not good for anyone. But what we found, and this is the good news, and by the way, no one necessarily knew this in March or April. If we would have done it. But what we found is if we can convince a large majority, preferably 100%, but at least a large majority of Mississippians to wear a mask in public, to maintain social distance, to stay aware, help us drive these numbers down. What we're beginning to see, and by the way, this is not unique to Mississippi, we're about 10 to 14 days behind Arizona and Texas and Florida in terms of where they are on their curve. They saw a significant uptick faster than we did. And so they actually turned it over a little bit faster than we did because of that. But we've seen in Arizona and Texas and Florida and to a lesser extent in other southern states that these little things will work. You know, that's what's important here. That's the message of today. I know that, some of you want to talk about what's happening in the Capitol, and that's all real important. And some of you want to talk about schools, and that's really important. But here's the message to take away from today. What we're seeing in states around this country is that if you will maintain social distance, if you will wear a mask when in public, if we can maintain capacity limitations in restaurants and bars and other places, that we can make a huge difference. I'll give you an example. I told you over the peak from July 30th to August the 9th, Mississippi's cases, 7-day trending average is down 30.4. From the peak to today in Tennessee, for instance, that number's down 24.7%. So what you're seeing is Mississippi's doing a little bit better, not a lot, but a little bit better. But what you're seeing is in states across the country where there is participation, then you're seeing downward trends. What I would also tell you, and I monitor this, I watch it very closely, but there's also in the upper Midwest and throughout the what's I would say a little further west in the Midwest, we're seeing cases rise, we're seeing test positivity rise, and so this thing is not going to be over even if we can get our hospitalizations back to where they were in early June. We can get it under 500, say, just as an example. This thing's not over, and it's not going to be over, as Dr. Dobbs said, until we actually have a vaccine. And I'll be perfectly honest with you, whenever the first vaccine hits the market, it's still not over. We're still going to have to take precautions because while the vaccines that are being done now, they're clinical trials with 30 or 60,000 people, which is a big number of people, obviously. But a clinical trial with 60,000 people in a country of 360 million. There are going to be issues that we got to deal with. And we know that the flu vaccine, which many of us take every year, is very rarely 100% such that it works every single time. And so we're going to continue to have cases, and we've got to, the entire goal is to manage and mitigate the risk associated with it. And that's what we're doing every single day, and every decision we make, that's what it deals with.
Nick June with Jackson Free Press has a question.
Yes, Dr. Dobbs, how many students and teachers are currently quarantined or, in the case of an exposed teacher, operating virtually as a result of the 34 exposures? And I will have a quick follow-up to that.
We're still collecting data. I don't have that information about how many are quarantined. So sorry about that, but we'll continue to collect information, and that should be something we should have available in the near future.
Right, and of those quarantined, as you're seeking that data, I think it'd be very interesting to see how many are actually seeking testing to see if the exposure resulted in transmission. I understand that's not mandatory, but information on testing for the school exposures would be of value to everyone.
And I'll say, though, if you are exposed in a school setting, we do encourage you to get tested. We did try to test folks in Corinth and have tested some. We have a testing event up there now, but there has been some reluctance on parents to do the nasopharyngeal swab, but the oral swab's an option. So we're going to try to make sure we make it as accessible and palatable to everybody, because we do really want to test folks who've been exposed.
Emily with the Associated Press has a question.
Hi, Governor. You have already answered extensively about the Unemployment Trust Fund. I wanted to ask you about other funding that Congress might provide to state or local governments. Do you want Congress to provide some more money to Mississippi for virus relief?
Emily, I'm concerned about the deficits that will be left to my kids and my grandkids. I'm gravely concerned about those deficits. I have been a fiscal hawk my entire life, because I understand that government doesn't have anything that it does not first take from somebody else. Having said that, we are in a pandemic, the likes of which we haven't seen in nearly 102 years in this country, and I also recognize that desperate times call for desperate measures. But let's look at some of the specifics. For instance, the Republicans in the Senate have called for an additional $1 trillion. Now, I remember when $1 trillion, even in Washington, was an enormous amount of money. The Democrats in the House have said, no, that's way too little. But let's look at what the Democrats want to spend money on. The Democrats have proposed a $950 billion state and local government fund. Now, I don't know exactly how they want to spend it. My guess is they don't want any of the red states to get it. But let's just assume for a second that Mississippi would be, quote unquote, entitled to our fair share of that $950 billion. That would mean if we have approximately 1% of the population, that Mississippi would be entitled to $9.5 billion. Now, Emily, you and Jeff and others have been around long enough to know that $9.5 billion in Mississippi is just shy of the entire general fund budget in our state for 2 years. That's what Mississippi would be entitled to if we get 1% of our annual operating budget. Now, some of that could be distributed, obviously, to cities and counties. But again, that's just a remarkable number and I don't know where it comes from. I'm afraid that there are those that are trying to take advantage of this situation to deal with every financial poor decision made, particularly in other states. They're trying to use these monies to shore up not only their unemployment trust fund, but also shore up their retirement funds, shore up their annual operating budgets, etc. The Mississippi legislature passed a budget this year which cut budgets for most between 3% and 5%. That was and I was, governor's office got cut 5%, and I signed, I believe, 106 or 107 of the 110 bills. That's because Mississippi was in a much better shape fiscally than the vast majority of other states. But I just want to highlight that again. $950 billion proposed by the Democrats in the U.S. House. That $950 billion would mean Mississippi would be entitled to the word I will use, if we get 1% of our 1% of the 950 because we have 1% of the population. $9.5 billion, which again is 2 years of an annual operating budget by the state of Mississippi. That's an enormous number, and it's just not realistic. The first CARES Act that we've been talking about in Mississippi was $150 billion. I believe the Trump administration has actually offered at least that much again. But there's a long cry from $150 billion, where we got $1.25 billion in Mississippi, and $950 billion, which is what the House Democrats are asking for. And so, we're gonna play the game as it is under the rules that we see it. But I am gravely concerned about future deficits and the fact that my kids and my grandkids could be paying this back for a long, long time. Yes, ma'am. Yes, sir.
Thank you, Governor. This is kind of a follow-up question of what I asked Dr. Dobbs, but I'd like to direct it to you if I may. So switching back gears to the colleges, we just heard from Dr. Dobbs that they are a big concern. Move-in day, people aren't wearing masks. That would be a violation, I guess, of the statewide mask mandate. As our leader, being the governor, do you feel it's you or the government's responsibility to make sure college campuses, college towns are enforcing these mask mandates, and how would you step up to tell them or do what you can for colleges to follow?
Yeah, and look, we hear anecdotal stories in every community around the state, and one of the things that I have seen pretty regular is there's all kind of people who want to tell on their neighbor, or all kind of people who want to tell on their competitor, or all kind of people who want to tell on this town or that town, and sometimes they're legitimate, but there's no doubt that we need our local governments. We need our local campus police. We need our local governments in these college towns to step up and help us make sure that we are slowing the spread of the virus by ensuring that people are doing the little things that make a difference. I'll give you an example. I don't want to shut down bars in the state of Mississippi. I don't want to shut down bars in college towns. But if it becomes clear and evident to me that the bars are not adhering to the laws that we have put in place, if it is clear and evident to me that they are serving alcohol after the prescribed time, if it is clear and evident to me that they are not requiring someone to be seated at a table where you can actually socially distance to get a drink, then I'm going to do what I have to do to slow down the spread of this virus. It's just, I don't want to do that. So here's the best thing forward. If those kids that are at college will wear a mask, either on campus or off, if our small business owners will work with us to make sure that they can stay open, but yet maybe not in exactly the way they would have done it back in January of the spring year when the kids first came back, then we can work together to live a relatively normal life, but in a way that doesn't put additional Mississippians at risk. And that's what this is all about. We know that most of these college kids, if we took these college kids and said, okay, you can't leave the city limits of this particular entity, and you have to stay there for the next 3 or 4 months, and if you get the virus, you're probably not going to feel that bad and everything will be okay, then we may have one decision to make. But if you tell me that these kids are going to be going back and forth to campus and back home, if they may be asymptomatic when they leave the campus, but when they come home, they become symptomatic and they give it to their mom, who then may give it to their grandmom. It's that, again, y'all hear me say this all the time, and it's I know you get tired of hearing it, but it's that for college kids, for the most part, now we do have deaths amongst the 18 to 29 age, just to be fair. So it does treat some really, really, really bad. Most of them will be okay. But it's that next iteration of the virus spread, and then more importantly, it's that second iteration where it goes from, for example, college student to mom or dad who is a nurse in a nursing home, who then takes it into the nursing home. And then we have fatalities because of it. That's what we're trying to avoid. And so, yes, I mean, if the question is, can I make a plea to all those mayors and city councils and board of supervisors and campus police and police chiefs in our college towns is, yes, please be diligent in the enforcement of this. I know it's hard. I know it's not what you normally do. I know that we all have a lot of other things to do, but it really is important over really the life of the fall semester, but particularly over the next couple of weeks when we know that there is a tremendous amount of community spread in certain areas, that we do the little things to help slow that spread.
So a quick follow-up, if I may. You are saying with your statewide mask mandates, with these curfews in certain areas, there's no exception on college campuses. These state laws still apply on the campus like they would if you're in public.
No, and quite frankly, I'll tell you that as I looked at the school reopening plans, I noticed that a large number of those districts did not have mask requirements, either for adults or kids, or in some instances both. And my decision to do a statewide mask mandate last Tuesday was in large part because of my decision to do a statewide requirement in our K through 12 schools that they have masks. And I felt like if I was going to do that last Tuesday, that it also made sense to go ahead and make it statewide so that everybody can get on the same page, that parents and kids and students and grandparents in our entire state realize that we are at a critical moment in fighting this virus. And the good news is we've turned over. The fact is we can pretend like we have won, and that would be foolish, or we can recognize that we are winning, and now let's put the gas to the pedal, and let's really work hard over the next several weeks, and let's really push these numbers down, which will help, in turn, that second iteration, that third iteration, and also help the integrity of our healthcare system. Yes, Renee.
Hunter Dawkins with the Gazebo Gazette has a question.
Thank you, Renee. Thank you, Governor. Governor, as it was reported today among the Division I universities, among the top five power conferences in athletics, most of them are are probably going to close down the fall sports. And with this, I'm kind of wondering about the MHSA's ruling, even though they have pushed back most sports at least for about 2 weeks until the 17th, when you're going to come forward and mention where we're standing at. But also too, with the school districts that you have delayed their opening, is there any type of idea from where we're going to stand, at least as far as athletics go?
Yeah, well, thank you for that question. And I will just tell you, I have been in fairly regular conversations with our university leaders with respect to college football. I have not spoken with them over the last 4 or 5 days, and it seems that the mood has changed amongst university leaders across the country. I'm not 100% sure exactly why that is the case. I don't fully understand why it is okay to put a whole bunch of college kids back in dorm rooms, but that it's not safe to play sports. I certainly understand that we need limitations on the crowd size, and that's really what we've been working on, because I've always said that the decision to play or not play will be a decision made either by the NCAA or the conferences, but the decision to protect the public health is one that in each state, and they tend to agree, that we have to make. And so we have focused on what will it look like if and when the Southeastern Conference, for instance, kicks off on September the 26th, and we'll continue to find ways for that. With respect to high school sports, we've had multiple conversations over the last week, and I would anticipate that you will see us, or you'll see me, make a decision in the coming couple of days with respect to what crowd size will look like. We will not have high school football in Mississippi over the next several weeks, which allows for thousands and thousands of people to be in the stands. That is not healthy. That is not safe. That does not make sense at this time. We can have high school football in such a way where we limit crowd size, where we are smart, not unlike what we've limited crowd sizes in restaurants, not unlike how we've limited crowd sizes in bars, not unlike how we've tried to encourage the reduction of number of people even in our churches. Although we don't believe we have the constitutional right to mandate it, we certainly can encourage our pastors to do it, and by and large they have. And so I would say that you can look for final guidance, at least for the next 2 or 3 weeks, coming in the next couple of days.
Joey Barnes with WCBI has a question.
Dr. Dobbs, this question is somewhat for clarity, but also to ask, if my understanding is correct, if a person tests positive, that positive case is assigned to their address in their home county. So if someone from, let's say, Walthall County is going to Mississippi State in Starkville, how is that tracked by the Department of Health and to give people who live in Ottawa County, in Starkville or Oxford and Lafayette County or Hattiesburg and Forest County a better understanding of what the virus count is in their home county?
Yeah, sure. So you're exactly right. The county that counts the case is the county of residence, and if the student puts, say, Lafayette, it would be Lafayette. If they put Pearl River, it'd be Pearl River as their home address. That goes with the medical record of where they were tested, right? So that certainly makes sense. Now, there are other metrics that we've used, and when we've looked at some of the stuff in Lafayette County, we have used the county and the zip code of the clinic to see where people are getting diagnosed, and that's something that we can provide to local counties so that they can use that information. Additionally, we are shifting the majority of our case investigation and contact tracing resources to students in K-12 and college, because we know that this is such a vulnerability. We want to make sure that we can do more in-depth investigations around those kids and teenagers and young adults. So we should have better visibility than we have historically, because we're going to really focus a lot of our efforts there, because that's going to be our weak point for the next few weeks and probably next couple of months.
Yes, sir. Is your question?
Question for Dr. Dobbs. How many lawmakers at the state capitol tested positive for the coronavirus?
I checked today, our count was 49 lawmakers tested positive for coronavirus.
Seeing no other questions at this time, I want to thank everyone for being here with us. It's a little over an hour and 4 minutes since we began. I do appreciate what you are doing to get the information out to the people of this state. To my friends across the state, we are making a difference. I really appreciate what you're doing, and I urge you, in fact, I beg you, keep working hard, keep wearing a mask, keep social distancing. Stay away from large gatherings, stay away from large parties, stay away from large social events. In fact, if you can stay away from small social events for the next couple of weeks, it would make a big difference. So I appreciate what you are doing. It's working. We need to work harder, and I think we can and we will. Stay safe out there, and God bless.
And Governor, if you don't mind real quick, I want to add something. People